We got another major weapon in the pandemic war this weekend, but public health officials are warning we still have a long road ahead. Because while a third vaccine is being shipped out as I speak, the single-dose shot from Johnson & Johnson, the company has fewer than 4 million doses ready to go at the moment, which likely won't make a huge dent in demand over the coming weeks. Massachusetts Governor Charlie Baker said this morning that he expects the state will administer the first J&J shots next week. So with COVID case rates falling in the state, a number of businesses got to open their doors a little wider today, with indoor performance spaces and recreational facilities allowed to operate at 50% capacity, and no more capacity limits at all for restaurants, although distance and time restrictions remain. And while some have hailed the move, many others, including the head of the CDC, who's also still on Baker's Economic Reopening Advisory Board, by the way, aren't exactly seeing the wisdom of rollbacks like this across the country.
I am really worried about reports that more states are rolling back the exact public health measures we have recommended to protect people from COVID-19. Please hear me clearly. At this level of cases with variants spreading, we stand to completely lose the hard-earned ground we have gained.
Still, Governor Baker defended his move again this morning.
With respect to every decision we've made about either restricting what people can do or letting up a little bit on what people can do, all of those decisions since the very beginning of this pandemic have been difficult. I think it's important for everybody to understand that this is a constant balancing act. We'll continue to look at the data as we go forward, and as we have in the past, make adjustments in other directions if we need to based on what happens.
I'm joined now by two Massachusetts mayors on different sides of this debate. Somerville Mayor Joseph Curtatone, who announced today, by the way, he will not be seeking a 10th term in November, is sticking with his city's schedule to keep current restrictions in place for at least another couple of weeks. Weymouth Mayor Bob Hedlund is moving forward with the state's reopening. Mayor Hedlund, Mayor Curtatone, good to see you both.
Hello, Mayor.
Starting with you, Mayor Curtatone, by my count, 340-some cities and towns seem to be content with what the governor did in our state. Boston, a piece of Cambridge, and Somerville are not. What's wrong with what the governor is proposing or implementing?
Well, I think you've hit the nail on the head at the beginning, and it's been, this entire process. Not heeding the clear warnings and caution of experts like Dr. Walensky. Part of the governor's reopening task force and the head of the CDC, we have the fourth highest death rate in the country, Massachusetts wide. If this is the light at the end of the tunnel of vaccines, there's two problems. One, to give vaccines a chance, we need to keep transmission down, and there are new variants that are becoming more prevalent. It's a big risk right now. We put people's lives at stake. And secondly, we still don't have a vaccine rollout plan. We have sites that do not give equitable access to the people hit hardest by this pandemic. So again, this is another head scratcher that really flies in the face of the cautionary warning of experts.
Mayor Hedlund, where is Mayor Curtatone wrong?
Well, I'm not a doctor, Jim. I'm not a public health expert. We have to kind of be jack of all trades when you're the mayor, chief executive of the town. We rely on people that have specialties. I rely on not only my health department, but we have a partnership with Social Hospital. We're in consultation with professionals there, the head of infectious diseases there. Our partnership extends to having an ambulance service that is run by the hospital here in town for us, or a new vendor that does that service. We've partnered with them on a vaccination site. And just from all the input I get from the medical professionals, I'm happy with the decision that's made. And we're calling it a rollback. But if you look at what the governor has now allowed, it's really incremental. Some of the provisions aren't even going to result in anything. Having arenas at 12% capacity really isn't going to create a situation where you're going to see concerts come back or any major impact there. But
Mayor, restaurants at full capacity with time limits and 6 per table. Some recreational facilities that weren't open at all now going to 50%. When you say, you're not a public health expert, Dr. Walensky and Dr. Fauci were saying this weekend that exactly what we're doing is exactly what we shouldn't be doing in America until the rates go down even further.
Yeah, Jim, let me respond to that. 3 points. Number one, the trends are good, we believe, and we're comfortable in looking at the trends. Our high, I think, was in December. We were dealing with about 100 cases a day. We're down to 19 per day. We trust our new president when he tells us that the supply chain's improving on vaccination for the vaccine. But in terms of the restaurant openings, the example you used, I think what the governor came out with before didn't make sense when you were compressing hours and having people compressed into a shorter time frame. I think extending the restaurant hours is a good thing. Not only for the economy.
But Mayor, he's not extending the hours. He's saying you still can only stay 90 minutes. You still can only have 6 at a time. Let me put up a chart for you, by the way. This is a comparison from the New York Times and COVID Tracking Project of the trend in cases nationally and in Massachusetts. And I'm not a public health expert either, but they look pretty similar to me. And this is where Walensky and Fauci are saying, hold. If I can go back to you, Mayor Curtatone, if I can for a second. The flip side is I'm driving down Mass Ave on Saturday. Every third or fourth storefront is vacant. Places I used to shop at, used to eat at. Don't you have to create a balance, since these numbers are going down, that allow people to work and allow small business owners to stay afloat?
Well, I'm glad you used the word balance, because the governor likes to use balancing act. I like to call it a blood calculus. Those businesses need direct financial support, and I commend the governor for being responsive to municipal leaders like Mayor Hedlund and others to give direct financial support to small businesses. The governor of the legislature a couple months ago was $668 million. You can't have a full sustainable recovery of your economy without a healthy society. And the approach from the governor and the administration is that as long as we have hospital bed capacity, IC unit capacity, which is important, we want to maintain the stability of that system, we're okay. So we can open up a little because we can treat more sick people. The problem with that blood calculus is inevitably more people, which we could have avoided, are becoming more seriously ill, and consequently more people die. The fourth highest COVID death rate in the nation. Why? In a Commonwealth so rich in resources and medical capacity, it should never have happened. We don't, in a global good outcome.
Mr. Mayor Curtatone, I want to get Mayor Hedlund back in this if I can for a second. Most people, people like Mayor Curtatone aren't talking about waiting months. I think you postponed some of the reopenings a couple of weeks. Would a couple of more weeks, Mayor Hedlund, to make sure that the trajectory continues down not make sense? And I'm a little short on time.
It may. That's a valid point. We've had internal discussions here with our school department whether or not it made sense just to, worry about reopening fully next year rather than just for a couple of months at the end of the school year. But, we're comfortable here at Town Hall in Weymouth. We're going back to full and ending remote, coming back to full attendance at Town Hall on the 13th of this month. So we're pretty confident that we can do that and get back to some level of normalcy here.
Mayor Curtatone, I only have a minute left. Why are you not running for re-election? Quickly, if you can.
There's no political or personal calculus other for me where I'm at right now. I'm going to be all in, get my community through COVID, recapture the wins that were bringing us in a positive direction, make sure that works for everybody. And I'm 18 years in this job. I'm not tired of the job. I'm tired of COVID, but I could do this another 20 years. I don't think I should. I'm going to give everything I have these next 300 days to carry our community forward and keep us healthy, safe, and alive.
But I read in the Globe, you have no specific plans. You have no specific job. So come November, what are you going to do? Watch Jeopardy? What are you going to do with yourself? Seriously.
I guess I have to figure out what I want to be when I grow up. I have no idea. But listen, I live in town. I could do this another 20 years. I don't think I should. I've been blessed to do one of the most meaningful, and I'm sure Mayor Hedlund feels that about public service, especially in his community. It's probably the most meaningful work I'll ever do. I'll have enough clarity in mind to figure that out. I'm all into making sure I not only meet my responsibilities here, but carry the community forward.
We wish you luck. Before we go, Mayor Hedlund, what do you think of the performance over 18 years of the mayor of Somerville?
Well, I met him when he first went in, and that was a quick 18 years. I can remember being over there for an event, his first year of the job, and I want to be sure at the next Mayor's Association meeting that we're both together at before he leaves. I'm going to buy him a nice cold Sam Adams to celebrate his tenure.
And I will drink that with you, Mayor. I'd be honored. I would do. Appreciate it.
Well, I'll raise a glass to you, too. Mayor Curtatone, good luck in the future. I'm sure we'll see you before you leave. Mayor Hedlund, it's great to see you. It's been quite a while. Be well, gentlemen. Thank you for being here.
Thank you very much. Appreciate it.